One of
Awesome.
the biggest questions that we get, that I get personally, probably because at the salon we do Botox parties, is about Botox. And some of my clients think, oh, you know, maybe I missed the boat, maybe I waited too long. So who's a good candidate, and, you know, what does that look like?
So anybody that wants to improve upon the small or fine lines within the face is a candidate, typically over the age of 18. And we're talking cosmetic Botox. It's a neurotoxin, and it's been around for years and years and years. Its established safety has been, identified through numerous research. They use it now medically with certain conditions that cause dystonia or hyperactive muscles that maybe cause frequent contractions, which can in turn cause pain, or even sometimes deformity of a certain body part, any pain producing areas. I mean, we use it even in the bladder. So cosmetic Botox is all we perform at this clinic. You can use it also for headaches. We do not bill for insurance coverage of headache treatment. So oftentimes I will get asked that question, do you treat headaches with Botox? Yes, we do. But if you want your insurance to pay for it, you're better off going to a neurologist to have that covered. We've had several patients that have done that and paid out of pocket, and they can submit it on their own if they'd like. And we're finding more and more insurance companies are covering that. But for the majority of the population, we use Botox Cosmetic. We use the Allergan product, and it works wonderful as a preventive measure. So we're seeing younger men and women in their 20s use it to prevent those deep furrows between the eyes or on the side of the eyes or the crow's feet, to prevent those deep formations. Oftentimes we'll look at their parents and say, oh my gosh, I want to prevent this. I don't want these 11s. And then we also I have patients my oldest patient is in her 80s, and she has done Botox for probably 20 years, and she looks amazing, and she's done all sorts of fillers. And you have to be very careful when you get in that older population because of the laxity in the skin, and that Botox can precipitate out. But you know, once you evaluate the person in their 70s, 80s, you just have to be very careful and know what you're doing and where you're injecting.
Okay. And
I have a couple pictures. One of the most common spots, forehead and between the eyes. So here's a close-up, forehead before and after, very natural.
Yeah.
And then the 11s.
Okay, so that's just showing that like your skin won't crease there then when you're making those facial expressions.
Yep.
Okay.
And that's how it prevents that muscle from contracting. Therefore, you're not producing those wrinkles. And it's one of those things that the next common question I have asked is, well, how long do I have to do this? Recommended that you have injections every 3 to 5 months, depending on, number one, your time, the amount of wrinkle formation you're making, and also budget. So those are some factors that go into play. Some women would come every 2 months if their budget would allow, but unfortunately, we all have to talk money. So, but if you can do it on, 3 to 4 times a year, very, very effective in prevention. And, it's interesting, Alana, when I first started doing this in 2008, very few 20-year-olds were getting it. And it has since become a preventive medicine in aesthetics. It truly is one of the best things you can do to prevent or slow aging.
Mm-hmm. That's awesome. I know a lot of my friends do it and have done it for a while. I did it once, and I have several questions. So when I did it, I was probably 25, and I'm starting to get wrinkles in my forehead. I have a very expressive face, and I'm constantly moving it. And when I raised my eyebrows naturally, just constantly, but when I got it, my eyebrows were low, and I felt when I have a little too much to drink maybe, and if someone takes a photo of me, I can always tell I've had too much to drink because my eyebrows are like sitting on my eyelashes. So that's how I felt all the time. No one else noticed, no one said anything, but that's how I felt. So is that just kind of a placement issue, or was that, because I got it was not with you, it was someone else? Yeah.
Yeah, so that's a great question. And there's kind of a catch-22 with that, depending on how much. I have some women that want a little bit more expression, and I have some that want their forehead completely froze. So it's definitely an individualized treatment. Now, if you do have some heaviness in the eyelid, that's exactly the most common thing is people will notice. Nobody else really does, but they say, you know, when I go to put on my eyeshadow, my eyelids aren't, they're not as open as they usually are, and they notice it when they put their makeup on. So if that ever happens, you can modify by just raising those injection sites on the forehead. And then the injection sites here between the eyes will give you a little bit of a raise. So you kind of counterbalance those two injection sites. But it does get tricky, and it sometimes is trial and error. If somebody wants their whole forehead froze, you do risk a little bit of dropping. However, when you maximize that treatment, it lasts a little longer. So I tell people, if you want it froze and you want this to last the longest, you might have about a week or two where your eyelids feel a little bit heavy. But again, we do it on a case-by-case basis and have you come back in and alter whatever treatment based on the visits documentation.
Mm-hmm. That's awesome. And one thing I think is a misconception with Botox, some people say, oh no, you know, it makes you, I don't know, look like you're in a wind tunnel or your face. And I'm always surprised because people, they can't tell, you know, they're like, you'd be surprised who's been getting it for a long time. I mean, it doesn't make you look that way. And I think that's kind of an old school myth about it, that if you start, you're just going to look crazy as you age. I don't think that's
Thanks to Hollywood and all the media out there, there is a misconception that everybody's going to be frozen, but very, very natural. But again, there's some people that want more than others, and might appear to some that kind of know what to look for as being overdone. But we very strongly will visit. We feel that the patient should have a say in what their outcome is going to be. And then if we ever feel like it's too much or unrealistic, we just have that conversation with the patient. And most of the time they're very good about listening and knowing, but honestly, it's such a natural appearance when you're done, and does a lot for your self-esteem.
Yeah. What are the contraindications? Like, who should not consider getting it?
Well, age, you have to look at laxity of the skin. If we have an elderly person that has a lot of laxity, they don't have the volume or the collagen, then that can precipitate out into areas you don't want it to. So they would be at more risk for like eyelid ptosis or eyelid drooping. And then pretty much if you have any allergy to the product. I have injected people that have severe allergies to both medication and environmental factors. And typically what I'll do is just start with one area, inject just a tiny little bit under the skin, and then kind of wait and see what they do. And even those have done really, really well. If you have a rare allergy to like gentamicin, which is an antibiotic that's been around for years and years, and we don't really use it a lot other than in pretty much eye drops nowadays. There could be a cross sensitivity, but knock on wood, I've never had anybody have an allergy to the stuff. Not once.
Good. That's good. Most people can use it. I'm so sensitive and have every allergy, and I didn't have any problem with it. So if that says anything.